Most hospital health camps are designed to fail. You pack a community hall, screen 200 people over a weekend, and by Monday morning, your outpatient department sees 0 new patient visits from that effort. Screening hundreds of people without a follow-up mechanism is an expense, not an investment. This is a charity event that yields 0 new patient visits. To change that, we are going to implement a 5-step framework. This protocol is designed to achieve a minimum 25% conversion rate, turning transient camp attendees into paying, loyal patients. Before we start the steps, you need 2 things locked in. First, choose a specific medical department you want to grow. Second, secure a venue that is no more than 5 kilometers from your hospital doors. The goal here is simple. We are shifting the objective from generating vague community goodwill to measuring exact return on investment. The standard approach starts going wrong the moment the invitations go out. Hospitals often invite the general public, hoping sheer volume will translate to revenue. Step 1 is to narrow your focus. You need an audience that matches the specific patient profile of your most profitable or highest priority department. To boost cardiology, set up in a corporate office for stressed adults. For gynecology, choose residential housing societies. Step 2 dictates diagnostics. Drop vague checks and use screenings that reveal hard data: blood pressure, blood sugar, BMI, and bone density. We run these specific tests because they produce actionable findings. When someone sees a high sugar level right there on paper, they immediately recognize a problem that requires medical attention. General health tips attract crowds looking for free advice. Quantifiable abnormal findings create the necessary psychological urgency for a patient to realize they need medical care. Once you identify an issue, you move to step 3, the conversion pathway. This is how you bridge the gap between a bad test result in a community hall and a booked appointment at your reception desk. Every attendee with an abnormal finding gets an immediate offer. You give them a discounted OPD slot at your hospital, available that same day or the next, and strictly valid for only 7 days. Make the financial incentive too good to ignore. There is a specific tactic that amplifies this offer. Have a doctor from your hospital arrive for only the final 45 minutes of the camp to consult specifically on those high-risk results. Hearing a nurse say your blood pressure is high is concerning. Hearing a doctor look you in the eye and say, "I want to see you in my OPD this week," causes conversion rates to jump from 10% to 45%. Step 4 is data capture. The ironclad rule of a successful camp is that no person receives a screening without first surrendering their contact details. Every attendee must fill out a registration card. You need their name, age, area, and their primary health concern. But the most critical pieces of data are their mobile number and their screening findings. If you hand out medical insights but fail to collect their phone number or give them a discounted next step, you are relying entirely on the patient's own initiative to visit you. That strategy is guaranteed to fail. Step 5 removes that reliance completely. We stop waiting for attendees to walk through the doors and start taking proactive action. You assign one specific front office staff member as your camp follow-up executive. Their sole mandate is to call every single attendee who had an abnormal finding within 48 hours of the camp closing. A 60-bed hospital in Manjeri, Kerala proved exactly how well this works. They had run free blood pressure and sugar camps for 2 years, averaging 80 attendees each time, but generating almost 0 new patients. They redesigned their strategy around a targeted gynecology camp. They registered 94 total attendees. Out of that group, 61 women had at least one abnormal finding on their hemoglobin, thyroid, or BMI screenings. Within 48 hours, the front office called all 61 of those women. That single step drove 28 booked OPD visits, and 4 of those women became inpatients. The camp cost 12,000 rupees to run and generated 1.85 lakhs in revenue within 30 days. The follow-up phone call is the operational mechanism that extracts real financial value from the time and money you spend organizing the event. You now have a complete end-to-end pipeline to acquire patients deliberately, rather than waiting for them to find you. The framework is strict. Target the right audience, use actionable screenings, offer a conversion pathway, capture the data, and make the 48-hour follow-up call. Your next move is to design your mandatory registration card today and lock in a local venue. Set a strict key performance indicator for that event. Aim to convert at least 25% of your attendees into booked OPD visits. Tracking conversions is the only dividing line between an event that drains your resources and a system that consistently adds new patients to your registry.